All right, settle in, folks, for another deep dive. Today, we're tackling a really tough topic.
Yeah, it's definitely a challenging one.
Squamous cell carcinoma, SCC, specifically when it hits the tongue in cats and dogs. And this dive comes straight from source material shared by one of you listeners looking to really get a handle on this disease.
And it is a difficult one. Lingual SCC, so SCC of the tongue, it's known for being, well, particularly aggressive. And just its location right there on the tongue, it creates this unique set of hurdles.
Hurdles for finding it, hurdles for treating it.
Exactly. Both finding it early and treating it effectively. It's tough.
So our mission today, let's say, is to go through these sources you've given us and really unpack the core info. We want to figure out, okay, what is this cancer? How does it usually show up? And what are the realities of diagnosis and treatment? Like, what does it really involve?
Right. We'll pull out the key facts, the main insights from the material so you can walk away with a clear, grounded picture of this disease and why it's such a challenge.
Okay, let's dive in then. First things first, what actually is lingual SCC, medically speaking?
So basically, it's a malignant tumor. Simple as that sounds. It starts from the squamous epithelial cells. Those are the flat, sort of scale-like cells covering the tongue's surface.
Okay, the surface layer.
Right. Think of it as a specific kind of oral SCC, but because it's on the tongue, it has these unique, really problematic characteristics.
And the sources, they really hit hard on its nature, don't they? It's not like a quiet guest.
No, definitely not. It's known for being aggressive,
Bill
especially in how it infiltrates.
infiltrates, like growing roots.
Yeah, that's a good way to think about it. Like roots growing deep into soil, not just sitting on top. It rapidly grows and sort of digs its way deep into the tongue muscle tissue.
Wow, that deep local invasion. That sounds like it's going to cause major problems, especially with something as mobile as the tongue.
It really does.
Okay, before we dig more into how it behaves, who gets this? Is it common?
Well, it varies a bit between cats and dogs, according to the sources. In cats, unfortunately, SCC is the most common oral malignancy overall.
The most common? Wow.
Yeah, and the tongue is a pretty frequent spot for it, especially that area under the tongue, the sublingual area. We mostly see it in middle-aged or older cats, usually over 7 years old.
Okay, so definitely a big issue for cats. Most common oral cancer. Tongue's a hot spot, especially underneath. What about dogs?
For dogs, oral SCC is the second most common oral malignancy. Melanoma is #1 for them.
Ah, right.
But SCC can certainly involve the tongue, too. The sources suggest dogs tend to be a bit older when diagnosed, average maybe 10 or 11 years old. And interestingly, females seem to be more common.
Females more than males.
Seems that way based on the data, and some large breeds might have a higher risk. The material specifically mentions poodles, Labrador retrievers, and Samoyeds.
That's interesting, the differences. Most common in cats, second in dogs, but still a tongue issue for both. Age, maybe breed, and sex in dogs. Now, do we know why? What causes this?
That's the million-dollar question, isn't it? The exact cause for lingual SCC specifically. It's largely unknown, which is frustrating.
So unlike skin SCC, you can't really blame the sun for this one.
Right, exactly. UV radiation isn't really considered a factor for tumors right on the tongue.
Okay, so what are the suspects then?
Well, the sources talk about suspected factors, things like maybe chronic irritation or inflammation in the mouth, maybe exposure to environmental carcinogens.
Like what?
Well, one source specifically points a finger at secondhand smoke as a possible link in cats.
Interesting.
Another one mentions potential associations, again in cats, with things like flea collars and even certain canned foods, specifically tuna was mentioned.
Flea collars and tuna. Really?
Yeah, but it's really important to stress these are suspected links. They're being looked at, but they're not definitively proven causes based on the material we reviewed. Just associations.
Gotcha. So still a bit of a mystery on the trigger, but some potential environmental hints, especially for cats. Okay, let's talk about its behavior. You said aggressive locally, it infiltrates. How does that play out? And does it, spread elsewhere?
So this local behavior, this infiltration, it's really the core challenge here. Because it's so highly locally aggressive, it just rapidly invades deep into the tongue muscle.
Right.
And this isn't just, a minor detail. It's the main reason why surgery to get it all out is so incredibly difficult, sometimes impossible, without causing huge problems for the pet.
Because the tongue does so much.
Exactly. Eating, swallowing, grooming. trying to get clean surgical margins, cutting out all the cancer with a safety border on a tumor that's woven into that vital moving muscle, especially at the back of the tongue or underneath. It's incredibly hard. Makes local control a real battle.
So the problem isn't just that it's there, but how it digs in. Does it also travel, spread beyond the tongue?
Yes, it definitely has metastatic potential. It can spread. The nearby lymph nodes, the regional ones, are a big concern.
Like the ones under the jaw?
Yeah, the mandibular nodes under the jaw and the retropharyngeal ones further back. The sources mention kind of variable rates of spread to these nodes. One source gave a really wide range for dogs, like 0 up to 43%.
Wow, up to 43%.
Yeah, spreading through the lymphatics to those nodes and potentially even to the lungs.
So even lung spread is a risk in dogs from this data.
It seems so. For cats, the sources tend to suggest the disease often gets pretty advanced locally before spread becomes clinically obvious. Distant spread, like to the lungs, it seems less common at the initial diagnosis compared to that local invasion or node spread.
But it can still happen later on.
Oh, absolutely. As the disease progresses, the sources do note lung mets seem more common in dogs and usually look like little nodules on chest x-rays.
Okay, so the main fight is often local and regional nodes, but distant spread, especially lungs and dogs, is a possibility down the line. Given how nasty this thing is locally, what signs might an owner or, a vet notice? What does it look like from the outside?
Well, this is where it gets tricky again, because the early signs, they can be really subtle, really nonspecific. And let's face it, getting a good look at a pet's entire tongue and mouth isn't always easy when they're awake.
No, they don't exactly cooperate for that, do they?
Not usually. But the common signs the sources mention relate mostly to, mouth pain and trouble using the mouth. Oral pain is common. You might see them reluctant to eat or having trouble chewing, maybe even crying out when they try to eat.
Okay, pain makes sense.
And dysphagia. That just means difficulty eating or swallowing. Very common. Pets might drop food, seem hesitant, maybe avoid hard kibble altogether.
Pain, difficulty eating. Any other red flags?
Halitosis. Like really foul, necrotic, bad breath. That often happens because the tumor tissue can die off and get infected.
Okay.
Excessive drooling, too, which is called tyolism. Sometimes it might even be blood-tinged, or you might see actual bleeding from the mouth from the tumor itself. Oral hemorrhage.
Is the tumor itself usually visible when these signs start, or is it hidden?
Often, yes, it becomes visible eventually. It might look like a growth sticking outwards that's proliferative, or it could be ulcerative, like an open sore. Sometimes described as looking like cauliflower or just irregular. Often red, inflamed, and friable, meaning it bleeds really easily if you touch it.
And like you said, often hidden under the tongue in cats.
Very often in cats, yeah, in that sublingual area. Which is why those subtle signs, like dropping food or bad breath, might show up way before anyone actually sees the mass.
Right.
Other things can include weight loss, obviously, because eating hurts or is difficult. Gagging, retching, just general lethargy. Being depressed. And sometimes you can actually feel those enlarged lymph nodes under the jaw. Less commonly, the sources mention things like facial swelling or even swelling, like right in the lower jaw area in cats.
Man, those signs could definitely be mistaken for other things at first. Dental disease, maybe just an infection.
Absolutely.
And combine that with the difficulty of even getting a good look. You can see why diagnosis might get delayed.
It really underscores why you need a thorough exam, often under sedation, to really see what's happening back there.
Okay, so you have these suspicious signs. How do you actually confirm it? How do you know for sure it's lingual SCC and not something else?
Right. So the diagnostic process the sources lay out has several key steps. First is that really thorough oral exam we just talked about. And yeah, it almost always needs sedation or even general anesthesia.
To really get in there.
Exactly. So the vet can safely and completely check the whole mouth, tongue, under the tongue, tonsils, back of the throat, assess any mass, check the teeth, feel those lymph nodes carefully.
Okay, super careful look under sedation. What actually confirms what it is?
The absolute gold standard for a definitive diagnosis. That's a biopsy. Specifically, an incisional biopsy, meaning taking a small piece of the tumor.
Okay.
That tissue sample then goes for histopathology. A specialist looks at it under a microscope, identifies the cells, confirms it's SCC, and the sources really stress getting a good sample deep enough because these things are infiltrative, remember?
Right, those roots.
Yeah. And biopsying the tongue, it's not always simple. It can bleed a lot. Some lesions are deep. Sometimes cytology is done first, looking at cells scraped off the surface. But that can be tricky if there's lots of inflammation or infection. It can kind of hide the cancer cells.
So biopsy is really essential. What about imaging? Does that help see how far it's spread locally?
Oh, imaging is critical for what we call local staging, figuring out the tumor's exact extent right there in the mouth and neck. A CT scan, especially of the head and neck, is highly recommended, often considered the best tool for this.
Better than x-rays.
Much better for this. It gives you this detailed cross-sectional view, shows exactly how far the tumor's invaded the muscle, if it's hitting bone like the jaw, its relationship to important structures nearby. Absolutely vital info if you're even thinking about surgery or radiation planning.
Okay, so CT gives the detailed local map. What about checking for spread further out, metastasis?
Right, that's the staging part, checking for spread. You absolutely need to check those regional lymph nodes, the mandibular and retropharyngeal ones, aspiration, sticking a needle in to get cells, or even taking a biopsy of the node itself.
Even if they feel normal.
Yes, the sources strongly recommend checking them even if they don't feel enlarged, because microscopic spread tiny clumps of cells you can't feel can already be there, especially those draining mandibular nodes. If a node feels dodgy or is big, maybe even remove the whole thing, an excisional biopsy.
Okay, sample the nodes. What else for staging?
And you absolutely must get thoracic radiographs, chest x-rays. Usually 3 different views are recommended to check the lungs for distant spread. A thoracic CT is even more sensitive, picks up smaller lung spots, but x-rays are the baseline.
Got it. Thorough exam, biopsy, local CT, check the nose, check the lungs. That's quite a workup. I imagine there are other things this could be confused with, things to rule out.
Oh, for sure. There's definitely a list of possibilities, what we call the differential diagnosis. Based on the sources, you got to consider other oral cancers, like malignant melanoma, that's the most common one in dogs, remember?
Right.
Or fibrosarcoma. Even benign tumors, though they're apparently rare right on the tongue itself, like papillomas, fibromas, mast cell tumors, granular cell tumors are also mentioned.
So other tumors, benign and malignant. What about non-tumor stuff?
Yeah, you also need to rule out non-cancerous things like gingival hyperplasia. That's gum overgrowth, but usually looks different than a tongue lesion. Or inflammatory or infectious problems like granulomas, lumps of inflammatory cells, abscesses, severe mouth inflammation, stomatitis, gingivitis.
Okay.
Trauma, too. Maybe they bit their tongue or chewed something sharp. Or just general inflammation and ulcers on the tongue, ulcerative glossitis. Even a reaction to a foreign body stuck somewhere.
That's a good point. Not every lump or sore is cancer, but those symptoms definitely need a thorough check to rule out something nasty like SCC.
Okay, so once you do have that confirmed diagnosis, lingual SCC, what are the treatment options? The sources really make it sound like this is where it gets, well, really tough.
It really is. Because of that aggressive nature, that problematic location, a multimodal approach is often the way to go, combining different therapies.
Multimodal, okay.
Yeah. The main goals are usually, local control, if you can get it, managing pain really aggressively, and just maintaining the best quality of life possible for the pet.
Makes sense. What's the primary weapon sort of against the local tumor itself?
Surgery. Specifically, partial glossectomy, removing part of the tongue that's the preferred route for local control if, and it's a big if it's feasible. The aim is always complete excision with wide margins. Cut out the tumor plus a border of healthy tissue around it.
But you said that local invasion makes surgery really hard. Exactly. It's often incredibly challenging, sometimes just not possible, especially for tumors way back on the tongue or ones that have spread diffusely through the tongue muscle, or those sublingual ones in cats without causing massive functional problems.
Right.
Getting those clean margins, it's a major hurdle. The sources mention that anywhere from 35 to 50% of these partial glossectomies might end up with incomplete margins, meaning some cancer cells likely got left behind.
And if you leave cells behind?
High risk of it growing right back. Local recurrence is a big problem if margins aren't clean.
Wow, that sounds like a real catch-22.
Yeah.
Surgery is the best local option, but the tumor makes it hard to do completely, which means it might just come back anyway. How do pets even cope with part of their tongue removed?
It sounds drastic, I know, but pets can actually adapt surprisingly well after partial removal, especially if it's the front part or the sides. Removing more from the back, a caudal resection that usually causes more significant deficits, makes eating and swallowing harder.
Okay, and post-op care.
Often requires things like feeding tubes, at least temporarily, while they heal and adapt.
Okay, so surgery. Attempted if possible, but often limited. High risk of recurrence. What about radiation?
Radiation therapy, yeah, that's another major tool. It can be used as adjuvant therapy, meaning after surgery, especially if those margins weren't clean,
Yeah.
to try and zap any leftover microscopic cells.
Mop-up duty.
Kinda, yeah. Or it can be the primary treatment if surgery just isn't on the table for that particular tumor. The goals are similar: local control and also significant pain relief. There's also palliative radiation, which uses lower doses just focused on shrink of the tumor enough to improve comfort and quality of life.
How well does radiation work for these tongue tumors?
The sources describe them as moderately radioresponsive, which means they react but maybe not perfectly or for super long. Response times can be short. One source mentioned less than 7 weeks in a specific study group.
Not very long.
No, but it can still provide really significant pain relief and some local control, especially maybe for that microscopic disease left after surgery.
What about side effects? Radiating the mouth sounds rough.
It can be. Because you're treating the mouth, acute side effects are pretty common and can be painful. You can get inflammation of the mouth, lining mucositis, the tongue itself, glossitis, the throat, pharyngitis, skin reactions too. And unfortunately, yeah, that can make eating even harder for a while.
Yeah.
Longer term, you worry about late effects like maybe chronic dry mouth or rarely bone damage, osteonecrosis.
Okay, so radiation helps locally and with pain, but has its own set of challenges impacting quality of life. What about chemotherapy?
Drugs. The systemic chemo, treating the whole body with drugs, is generally considered not very effective as the only treatment for lingual SCC based on these sources.
Not a primary weapon here.
Not usually on its own, no. Its main role tends to be adjuvant again, used with other things, especially if there's documented metastasis, spread to lymph nodes or distant organs, or maybe for really high-grade, aggressive-looking tumors. But the efficacy is often described as, well, modest.
Modest. Okay.
Yeah.
Are specific drugs mentioned?
Yeah, several are listed: cisplatin, carboplatin, doxorubicin, mitoxantrone. One source actually gives some specific dosages.
Oh, really?
Yeah, like carboplatin for dogs at 250, 300 milligrams per square meter IV every 3 weeks. For cats, 180, 250 milligrams per square meter IV every 3-4 weeks, maybe 4 or 5 treatments. It also mentions piroxicam, which is an NSAID and anti-inflammatory.
Right, you mentioned that earlier.
Yeah, the dose example for dogs was 0.3 milligrams per kilogram orally every day. For cats, it notes no official dose but mentions 0.3 milligrams per kilogram orally every other day has been used. And tosrenip phosphate palladia is also mentioned for oral SCC in dogs generally. Might have some activity here too. Dose given was 2.75, 3.25 milligrams per kilograms every other day.
Okay, so chemo's role is mainly for spread or really aggressive cases, often with limited success. But those drug specifics are useful context. The piroxicam, the NSAID, how does that fit in again?
It's interesting, right? Some SCCs express this enzyme, COX2. NSAIDs like piroxicam block COX2. So besides reducing pain and inflammation, which is huge in the mouth, they might actually have some direct anti-tumor effects too. So they're often used alongside other treatments or just for palliative care. That source mentioning piroxicam noted a 17% response rate for oral SCC overall, and specifically one partial response in 3 dogs with lingual SCC with progression-free time around 3.5 to 6 months. So potentially some benefit there.
That's fascinating, that dual role. What about electrochemotherapy? That sounds futuristic.
Yeah, electroporation or electrochemotherapy, ECT. It's a technique where they apply these brief electrical pulses right to the tumor. These pulses make the cancer cell membranes leaky, basically, more permeable for a short time,
Okay.
which helps deliver chemo drugs like cisplatin or blumycin directly into the tumor cells much more effectively. The sources suggest it shows some promise for local control, especially for tumors you can't operate on or ones that have come back.
Interesting. And finally, palliative care. It sounds like, given all these difficulties, this must be incredibly important.
Absolutely critical. Especially for pets where the tumor just can't be removed or it's already spread. Palliative care is purely focused on maximizing comfort and quality of life.
So what does that involve?
It can include palliative radiation, like we mentioned, definitely aggressive pain management, often needing a cocktail of drugs like NSAIDs, opioids, maybe gabapentin, amantadine, antibiotics if the tumor gets infected, appetite stimulants, and, vitally, nutritional support.
Right, the eating problem.
Exactly. The sources really hammer this home. Feeding tubes, esophagostomy or gastrostomy tubes are often essential, especially for cats, even early on, because the pain makes eating just impossible. They are a key part of managing this and maintaining quality of life.
That makes total sense. If they can't eat, you have to provide nutrition some other way.
Okay, so with all these treatment challenges, the aggressive nature, what is the typical outcome, the prognosis? The sources said guarded to poor.
Yeah, unfortunately, it's generally the outlook, guarded to poor, especially in cats. It's mainly driven by that aggressive local invasion, the difficulty getting clean surgical margins, and just the huge challenges managing pain and nutrition. It all combines to make long-term control really, really tough. Let's break that down by species again. For dogs, what's the prognosis typically look like?
For dogs, it often depends a lot on where the tumor is and if you can get it out completely with surgery. Tumors near the front of the tongue might have a slightly better outlook than ones way back. The sources often quote median survival times, MSTs, that's when half the patients are still alive, grouping tongue SCC with other oral SCCs treated surgically. Those range maybe 6 to 12 months.
Okay.
But one source had more specific data just for subtotal glossectomy, removing most of the tongue in dogs. The MST there was only 216 days, and it noted less than a quarter of dogs in those studies survived a full year.
Wow. So even with really aggressive surgery, long-term survival is not great.
Not typically, no.
And cats, you said it's particularly bad for them.
Yes. Unfortunately, the prognosis in cats is usually described as very poor. Lingual SCC in cats is just extremely aggressive and really resistant to effective long-term treatment. The median survival time is often brutally short, like 2 to 5 months, even with treatment.
2 to 5 months.
Yeah. Surgery or radiation might offer some temporary help, slow things down briefly, but they're very rarely curative. That really challenging sublingual location, the rapid invasion, it just limits the options for real control. One source specifically gave an MST of around 3 months with palliative radiation and chemo in cats.
3 months median survival.
Yeah.
That number just hits hard. It really highlights how devastating this is in cats and why that palliative care focus is so critical.
It really does.
Are there specific things that make the prognosis even worse, particularly in dogs, where there seems to be a bit more data?
Yeah, the sources list several negative prognostic factors for dogs. Things like the tumor being far back on the tongue caudal location, getting incomplete surgical margins. If the tumor comes back after treatment, recurrence, if it's a bigger tumor, say over 2 centimeters.
Okay.
Also the histological grade, how aggressive the cells look under the microscope. Grade 1 tumors had a much better MST, like 16 months, compared to grade 2 or 3rd tumors, where MSTs were only 3 or 4 months in one study. And of course, if it's already spread, metastatic disease at diagnosis.
So it's spot, how well it's removed, if it recurs, size, cell appearance, and spread, all critical factors. Given this guarded prognosis and the risk of recurrence, what does follow-up look like? Monitoring after treatment.
Yeah, post-treatment care is really about close monitoring. You need to watch carefully for any side effects from the treatments, both short-term and long-term. Ongoing pain management, assessing it, adjusting it, that's absolutely crucial throughout.
And nutrition.
Yes, monitoring nutritional status weight, how much they're actually taking in, managing those feeding tubes if they're in place, that's essential too.
And checking for the cancer itself coming back.
Right. Regular rechecks are key, often every 1 to 3 months, at least initially. These should include a thorough oral exam, again, maybe under sedation and carefully feeling those regional lymph nodes, and then periodic imaging rechecks, usually chest x-rays to keep an eye on the lungs for spread, and maybe repeat CT scans to look for local recurrence or progression.
So even after initial treatment, it's a real commitment to ongoing vigilant care. This is clearly a massive amount of really difficult information for an owner to take in. Based on the sources, what are the absolute must-communicate points for vets talking to owners facing this?
Client education is just paramount here, isn't it? Because it's such an emotionally heavy and difficult disease. The sources really emphasize that vets need to stress the aggressive, invasive nature of lingual SCC right from the start.
No sugarcoating.
No, they need to clearly explain why treatment is so difficult, that challenging location, the problems getting long-term control.
And being realistic about the outcome.
Absolutely. Realistic about that, generally guarded to poor prognosis. Making it really clear, especially in cats, that the time remaining is often measured in months and the main goal becomes palliation. Managing symptoms, managing pain, maintaining the best possible quality of life for whatever time they have.
Right.
They have to emphasize that aggressive pain management isn't optional. It's absolutely necessary for the pet's comfort.
And preparing them for the practical side, like feeding tubes.
Yes, definitely preparing owners for the high likelihood of needing a feeding tube. Explaining why it's so crucial for managing pain and getting nutrition in, especially for cats who find eating agonizing with this. The focus really has to be on supporting quality of life above all else.
Okay.
And being transparent about the costs, too. The advanced diagnostics, complex treatments, long-term support, it can all add up significantly. That needs to be discussed up front.
Any other key communication points?
Just maybe mentioning that while catching it truly early is tough because of the location and subtle signs, earlier detection still offers the best chance for any intervention to have some effect, even if it's just palliative. And suggesting a multidisciplinary team approach, maybe involving veterinary dentists, oncologists, internal medicine specialists, can help owners feel supported and understand that several experts might contribute to the best care plan.
Okay.
Yeah.
Wow, this has been a really, really deep dive into such a tough subject. Let me try and recap what we've pulled from the sources here. Lingual SCC. It's this highly aggressive tongue cancer in dogs and cats. The huge challenge is its rapid invasion into that vital tongue muscle. We don't really know the exact cause, though things like secondhand smoke are suspected, especially in cats. It digs in locally, spreads to nearby lymph nodes, and can eventually go distant, like to the lungs.
Right.
Signs can be subtle at first: pain, trouble eating, bad breath-making, diagnosis tricky. It needs a sedated exam. Biopsy is key for confirmation, and then staging with CT scans and chest x-rays.
Yep, that's the workup.
Treatment is super complex because of the location. Surgery is tough to get clean margins. Radiation can help locally and with pain, but has side effects. Chemo's role is often limited.
Often palliative or for metastasis, yeah.
Prognosis is generally guarded to poor, devastatingly short in cats, often influenced by location, surgery success, recurrence, spread. And throughout all of this, aggressive pain management, nutritional support, often needing feeding tubes, and focusing squarely on quality of life are absolutely paramount.
That's a fantastic summary. You've hit all the key points. And, that sheer difficulty of getting real curative control with this tumor, combined with just how essential the tongue is for a pet eating, drinking, grooming, interacting, it really makes maintaining comfort and quality of life not just part of the treatment plan, but often the most achievable and honestly the most important goal.
It absolutely underscores that. And it really makes you pause and think about those everyday moments with your pet, doesn't it? How eager they are for food, the way they lap water, groom themselves. It's all tied to that one organ. Considering how crucial the tongue is for just basic daily life in pets, how does the specific vulnerability of this location and the fact that it's so hard to see, how does that maybe change our perspective on what seem like minor signs, little changes in eating habits, maybe slight oral discomfort? What subtle cues related to their mouth might we as owners, or even vets sometimes, be too quick to dismiss just because looking right under the tongue isn't something we do every single day?